A day in the life of a dentist. Come with me, guys. So I got to work, and the first thing I did was to change to my scrubs. I like to wear scrubs as well because I find it very comfortable. I don't wear it all the time, but sometimes I do. Then the next thing I did was to wear my earnets. So this was me just trying to wear my earnets in this place. I like to cover my ears because I don't want air entering my patient's mouth or their face when I'm working on them, or air disturbing me while I'm getting some procedures done. And when I was done, I went ahead to test my dental loops. So dental loops are like, should I say, magnifying glass we use in dentistry to make sure we can visualize things better. It increases the size of things about 10 to 20 times, and this was me just trying to use the toothbrush to make sure it was working well. And when I was done, I moved on to my first patient of the day. This patient came in with a fractured tooth after I had an head-on collision with a friend, and unfortunately we could not save the tooth. We had to extract. So the first piece was already out, and this was me just trying to bring out the other piece. It was a bit difficult at first, but after so many attempts, which took about an hour plus, I was able to bring out the tooth, and you can see the two fractured pieces of the teeth. The next thing I did was to see my Invisalign patient. This patient came in with some attachment of on the tooth surfaces. So attachment are like little dots that we place on the tooth surface of a patient that wears Invisalign. We do this because we want a more specific movement of the tooth. We have a desired result in mind, and we don't want anything to tamper with it. So when she contacted us that some of our attachment had fallen off, we had to call her back so that we could replace the attachment back on the tooth surfaces. So these are the trays that we usually put the attachment template on. So each tray is specific for each patient. Like this tray is specially designed for this patient, fits this patient, so you cannot use it for another patient. So this was me just trying to place the attachment. I like to do mine one side at a time because I am not like an expert yet. So that was what I was trying to do here. So after I was done placing the attachments for this patient, I had to go to my third patient of the day. So this patient came in with a very tiny cavity on her tooth surface. She was very uncomfortable with the cavities because she's well aware that once a cavity starts to form, it just keeps increasing and increasing, and she didn't want that. So she came to the clinic so as to tackle it head on before it got worse. So I had to put this metal thing you're seeing. This is called a matrix band. I usually place matrix bands to separate a tooth from an adjacent tooth so that we can focus on the tooth we need to treat, so that whatever we are doing does not touch the adjacent tooth. So when I was done placing the matrix band, I started putting my filling. I like to put my filling in layers. I don't just put all my fillings at once because I noticed that once you pack them all at once like that, it usually doesn't stay as it should. So I like to condense my fillings layer by layer. So it was me just condensing my fillings, making sure they were very, very intact and well packed. And when I was done, I had to use my light. So the light is usually used to solidify whatever filling that you put so that it becomes as strong as a tooth, and you can use it to do whatever you like. When I was done, I went ahead to remove my matrix band, and when I was done removing my matrix band, the next thing I did was to start reducing the filling. I reduced filling because it might be too high and very uncomfortable for the patient. So as I reduce my filling, I like to check in with my patient to make sure they are okay. So I kept reducing and asking if she was okay. So when she said she was okay and it didn't feel high, she could chew, I went ahead and just cemented everything with my light, and that was all for the day. I was done. This was around 7 o'clock. I was already really tired, ready to go home, and yeah, that was the day for me. Bye, guys.